Hello everyone, welcome back to the Coding Doctor, where we simplify medical coding for healthcare students and professionals. Today we're diving deep into one of the most commonly coded conditions, hypertension. We will decode ICD-10 guidelines, understand all the hypertension codes, I-10 to I-16, look at examples, and I'll even share mnemonics to help you remember everything easily. So grab your notebook and let's get started. Hypertension simply means persistently elevated blood pressure. In ICD-10, hypertension codes fall under the category I-10 to I-16, which covers hypertensive diseases. Now, before coding, you must first determine 1. Is it essential or primary hypertension? 2. Or secondary to another condition? 3. Is there a hypertensive crisis or complication? Hypertension, or high blood pressure, is one of the most commonly coded conditions in ICD-10. But do you know how to choose the right code? From simple hypertension to complex cases involving the heart or kidneys, let's decode hypertension step by step. First, we have I-10, essential or primary hypertension. This is when there's no identifiable cause. It's the most common type, often linked with lifestyle, stress, or genetics. For example, if a patient has high BP with no secondary cause, you simply assign I-10. Next, I-15, secondary hypertension. This occurs when there's an underlying disease like a kidney disorder, endocrine issue, or thyroid problem. For instance, if hypertension is due to chronic renal disease or an adrenal tumor, use I-15 with the underlying condition. When blood pressure spikes dangerously, systolic above 180 or diastolic above 120, it becomes a medical emergency. That's I-16. Hypertensive crisis, we further divide it into I-16.0 hypertensive urgency, no organ damage, I-16.1 hypertensive emergency, with organ damage, I-16.9 unspecified crisis. Hypertension with organ involvement. Now, the picture gets more detailed when hypertension leads to organ involvement. We move into combination codes. I-11, hypertensive heart disease. When hypertension affects the heart, use I-11. If heart failure is present, use I-11.0. If not, use I-11.9. I-12, hypertensive chronic kidney disease. When the kidneys are involved, we use the I-12 series for hypertensive kidney disease. Notice the detail here. Codes like I-12.0 specify the condition with CKD, stage 5, or ESRD, end-stage renal disease. For stage 1 to 4 or unspecified, use I-12.9. I-13, hypertensive heart and kidney disease. The most specific combination is I-13 for hypertensive heart and chronic kidney disease. This series requires two characters to indicate the presence or absence of heart failure, such as I-13.0 with heart failure and I-13.1 without heart failure. And again, do not forget to specify the CKD stage separately while coding. Remember, accurate coding requires understanding the full clinical picture, from the cause of the hypertension to any resulting organ damage. Use these combination codes to capture the patient's condition comprehensively. Always review documentation carefully, identify if there's organ involvement or emergency features before assigning the code. This was a quick look at ICD-10 codes for hypertension. Now, we will learn in detail of each code for hypertension. Let's start with I-10, essential or primary hypertension. This is used when hypertension is not specified as secondary, malignant, or benign, simply hypertension in the note. Example 1. In the medical record, diagnosis is written as hypertension. For this, we code as I-10. Example 2. In the medical record of the diagnosis section, the following is written as high BP, stable, no heart or kidney disease. In this case, we also code it as I-10, mnemonic. I10 means single, solo, simple hypertension. Hypertension doesn't always act alone. When high blood pressure causes changes in the heart, such as left ventricular hypertrophy, or contributes to heart failure, we classify it as hypertensive heart disease coded under I11. This category specifically links hypertension with cardiac complications. The I11 series is used when a patient has a documented relationship between their hypertension and a resulting cardiac condition. Classifying it as hypertensive heart disease, the first and most complex code is I11.0, hypertensive heart disease with heart failure. This code indicates that the hypertension has progressed to cause or contribute to congestive heart failure. The second key code is I11.9, hypertensive heart disease without heart failure. This is used when the patient has a structural or functional heart abnormality, such as left ventricular hypertrophy, due to hypertension, but heart failure is not present. The critical distinction between these two codes is the presence or absence of heart failure. Always review the documentation carefully to ensure you capture the most specific and accurate code reflecting the patient's condition. When coding for hypertensive heart disease, the specific documentation of heart failure determines the combination code you'll use. Let's look at two practical examples. For example, 1. The diagnosis is hypertensive heart disease with congestive heart failure. This requires two codes, I11.0, the combination code, followed by a code from the I50 series to specify the exact type of heart failure, such as systolic or diastolic. In example 2, the diagnosis is hypertensive heart disease with no heart failure. This is a single code scenario. We simply use I11.9 as the heart damage, such as hypertrophy, is present, but it has not progressed to a state of failure. Mastering these combination codes ensures comprehensive and accurate reimbursement. Always check the patient's record for the presence or absence and the specific type of heart failure. To help you quickly recall this series, remember this mnemonic: I11 rhymes with heart heaven, think heart. This simple memory aid links the code series I11 directly to cardiac involvement. When hypertension damages the kidneys, we use the I12 series, which specifies hypertensive chronic kidney disease. Let's review the two critical codes in this category. The key to selecting the correct I12 code is determining the severity of the associated chronic kidney disease, or CKD. The code I12.0 is reserved for the most severe cases, hypertensive chronic kidney disease with CKD stage 5 or end-stage renal disease, ESRD. Documentation must confirm this advanced renal failure stage for I12.0 to be used. Conversely, I12.9 is used for hypertensive chronic kidney disease with CKD stages 1 through 4, or when the stage of the CKD is documented as unspecified. This is a common code for early to moderate renal impairment. Remember, I12 is a combination code. The level of kidney function, specifically the CKD stage, dictates whether you choose the severe stage I12.0 or the less severe / unspecified I12.9. Let's apply the ICD-10 rules for coding hypertensive chronic kidney disease. This combination requires a specific code from the I12 series plus an additional code to denote the exact CKD stage. In this example, a patient is diagnosed with hypertension and CKD stage 3. Since CKD stage 3 is not stage 5 or SRD, we use the general combination code IC12.9, but we must report the CKD stage separately using N18.3. Remember, I12 is a combination code, meaning it includes the link between hypertension and the CKD. However, to capture the severity, the specific stage, you must always list the relevant N18 code as a secondary diagnosis. To quickly recall this series, use this helpful mnemonic. I12, 1 to 2, think 1 kidney, 2 kidneys for renal involvement. This makes the code series I12 instantly recognizable for conditions affecting the kidneys. The I13 series represents the most advanced clinical scenario, hypertensive heart, and chronic kidney disease. These codes capture involvement of both organs simultaneously. The primary distinction for the I13 codes is the presence or absence of heart failure. If heart failure is present, the code choice then depends on the CKD stage. We use I13.0 when heart failure is documented alongside less severe CKD stage, that is, stages 1 through 4, or when the CKD stage is not specified. However, if the patient has heart failure and end stage renal disease or CKD stage 5, the correct code is I1 3.2. This code captures the most severe combination of hypertensive complications. If heart failure is not present, you use I13.10 or I13.11. In summary, coding I13 requires 3 steps. First, determine if heart failure is present. Second, identify the CKD stage. And third, always remember to add a secondary code from the I50 series for the type of heart failure and an N18 code for the CKD. Accurately selecting the I13 code is essential for reflecting the complex nature of cardiorenal syndrome. Review your documentation carefully. Let's tackle one of the most comprehensive coding scenarios when a patient is diagnosed with hypertension impacting both the heart and the kidneys. This requires a three-part combination. Consider this diagnosis: hypertensive heart and heart failure with CKD stage 4. Because the patient has heart failure and CKD, we look to the I13 series. The coding requires 3 distinct codes. First, I13.4 captures the hypertensive heart disease with CKD stage 4. Second, N18.4 specifies the CKD stage 4 severity. And third, I50 is needed to capture the specific type of heart failure, such as systolic or diastolic. To remember this complex code series, use this mnemonic: I1313 equals unlucky combo, heart and kidney both hit. This will help you immediately link A13 to combined cardiorenal disease. Unlike primary hypertension, secondary hypertension is high blood pressure that results as an effect of an underlying cause. Identifying this cause is essential for proper coding and treatment. The I15 series is used when the hypertension is due to another documented condition, such as renal disease, endocrine disorders, or certain medications. The largest categories relate to renal issues. I15.0 specifies hypertension due to renovascular disease like renal artery stenosis. I15.1 covers hypertension due to other renal causes, which includes conditions like polycystic kidney disease. Next, I15.2 is used for hypertension due to endocrine disorders. This includes conditions like Cushing's syndrome, hyperthyroidism, or primary hyperaldosteronism, where hormones directly influence blood pressure. Finally, I15.8 covers secondary hypertension due to other specified causes, such as medication. I15.9 is used only when the hypertension is confirmed as secondary, but the underlying cause remains unspecified. Remember, coding secondary hypertension is a two-step process. First, use the appropriate I15 code, and second, always code the underlying causative condition to provide the complete clinical picture. In coding secondary hypertension, we must pinpoint the underlying cause. Let's look at a common example involving the kidneys. The diagnosis here is hypertension due to renal artery stenosis. The renal artery narrowing is the cause, making the hypertension the effect. This specific relationship is captured by the code I15.0. The code I15.0 is used for hypertension due to renovascular disease. However, remember your ICD-10 guidelines. You must also report a second code for the renal artery stenosis itself to complete the documentation and explain the underlying pathology. For accurate documentation of secondary hypertension, ensure you always code the I-15 classification first, followed by the specific underlying cause. To quickly recall this series, here is a mnemonic. I-15 equals think secondary scene, the second reason for high BP. This links the I-15 series directly to the concept of secondary hypertension. A hypertensive crisis is a critical medical condition requiring immediate attention. The I-16 series in ICD-10 differentiates between two vital types, urgency and emergency. Both involve severely elevated blood pressure, often exceeding 180 over 120 millimeters of mercury. The key factor distinguishing them for coding is the presence or absence of acute organ damage. First, we have I-16.0 for hypertensive urgency. This code is used when blood pressure is critically high, but there is no evidence of acute target organ damage. This usually allows for gradual blood pressure reduction. Next, and far more serious, is I-16.1 for hypertensive emergency. This code is assigned when critically high blood pressure is accompanied by acute target organ damage affecting areas like the brain, heart, or kidneys. This requires immediate and rapid blood pressure reduction. Finally, I-16.9 is used for hypertensive crisis, unspecified. This code should be used sparingly only when documentation clearly states a crisis but does not specify urgency or emergency status. Accurately distinguishing between hypertensive urgency and emergency is not just for coding, it directly impacts patient management and the urgency of treatment. Always look for documentation of acute organ damage. In coding for a hypertensive crisis, the decisive factor is the presence of acute organ damage. Let's review two critical clinical examples from the I-16 series. In example 1, the patient presents with severely high blood pressure of 220 over 120 millimeters of mercury, but documentation shows no organ damage. This classifies the situation as a hypertensive urgency, which is coded as I-16.0. For example 2, the BP is even higher at 240 over 130 millimeters of mercury with acute renal failure. The renal failure represents acute target organ damage. This elevates the condition to a hypertensive emergency, coded as I-16.1. The bottom line is that a single-digit difference in the I-16 code reflects a major clinical difference: no organ damage, I-16.0, versus organ damage, I-16.1. Code accurately based on the documentation. To quickly recall this vital series in a high-pressure setting, use this mnemonic: I-16 equals think crisis scene. This connects the code directly to critical care scenarios. Coding for hypertension during pregnancy requires using the specific O code series in ICD-10. These codes capture maternal conditions and are essential for tracking pregnancy complications. We start with O10, pre-existing hypertension complicating pregnancy. Use this when the patient had high blood pressure before pregnancy. Remember the mnemonic OL10. Next, O11 is for pre-existing hypertension with superimposed preeclampsia. This represents a worsening of chronic hypertension. The mnemonic is old plus new PE. Moving to new onset hypertension, O13 codes for gestational hypertension without proteinuria. This is often temporary. Mnemonic only tension. O14 is for preeclampsia. This is defined by new onset hypertension and significant proteinuria. Think of the mnemonic overflow protein. The most severe complication is O15, eclampsia. This involves preeclampsia, with the addition of seizures. The mnemonic is fits in pregnancy. Finally, O16 is for unspecified maternal hypertension. Use this code only when documentation is incomplete. Remember the mnemonic? Obscure HTN. Mastering these 6 codes ensures accurate documentation of maternal risk and complications. Accurate hypertension coding is crucial for reimbursement and documentation integrity. Here are 5 essential ICD-10 guidelines you must follow when coding hypertension and its complications. Tip 1. Review documentation carefully. Always read the documentation thoroughly, looking for any evidence of heart or kidney involvement or an underlying secondary cause of the hypertension. Tip 2. Sequence combination codes. First, when heart or kidney involvement is present, use the combination codes I11 through I13 first, then add secondary codes like N18.X for CKD stage or I50.X for heart failure. Tip 3. Do not code separately. Never code hypertension and chronic kidney disease separately. CKD is assumed to be related to hypertension unless the documentation clearly states otherwise. Always default to using the comprehensive combination codes. Tip 4. Check for crisis before I10. When a patient presents with severely high blood pressure, always check for a hypertensive crisis, I16, before assigning essential hypertension, I10. I16 takes precedence. Tip 5. Use linking terms. Pay close attention to terms like due to or with. In ICD-10, these terms create a presumed link between the hypertension and any associated organ damage, justifying the use of combination codes. By following these 5 key guidelines, you can ensure your hypertension coding is compliant, accurate, and reflects the full clinical picture. Mastering hypertension coding is fundamental. We've explored the entire ICD-10 set, which is organized by cause and organ involvement. Here is a final, comprehensive review of the codes you need to know. Mastering this coding requires precision and a full understanding of the guidelines. To stay compliant and deepen your knowledge of ICD-10 guidelines, be sure to like, comment, share, and subscribe to our channel for more ICD-10 tutorials. Thank you.